hemoglobinuria in sheep and goat, the causes and diagnosis. To the etiological agents of hemoglobinuria, it can be divided into two: infectious or non-infectious causes. Then non-infectious causes, they may be either deficiency or excess. Most important deficiency is of phosphorus, where you can see hemoglobinuria. That is called post-parturient hemoglobinuria. Phosphorus deficiency is called hypophosphatemia or post-parturient hemoglobinuria. So post-parturient hemoglobinuria, it is very common in dairy goats also, fairly common in sheep. So this anemia appears because of the decreased ATP production in by the RBCs or inside the RBCs, and because the phosphorus is an important component of the phospholipid membrane of the cells. So the RBCs are being lysed because of very fragility of the RBCs. So post-parturient animals, they are more susceptible because definitely the animals are prone to hypocalcemia, hypophosphatemia because of drainage of mineral for the development of the fetus. And along with that, again, drainage of those minerals in milk during initial stage of milking in these animals. Because after parturition there will be huge amount of milk secreted by the animal for the calf, so the minerals are being drained out in the milk, so definitely there will be deficiency of these minerals. Now copper deficiency is also there, which may contribute to this severity of this anemia in case of hypophosphatemia, and that also causes lysis of the RBCs. And because there are certain enzymes which need copper, and these enzymes are important for antioxidant properties in the body, so when there is reduced copper in the body, these antioxidants produced in the body are reduced, so all the cells including the RBCs, they are susceptible to the oxidants, and there is lysis of the cell, the death of the cell. Hypophosphatemia may be because of reduced gastrointestinal absorption. The animal may be taking good amount of food, the owner may be feeding good amount of food to the animal, but because of reduced absorption from the gastrointestinal tract, and especially the phosphorus is absorbed from the duodenum, the the small intestine. Any damage in the small intestine, or because of excessive acidic pH and malabsorption from the GI tract. Again, as we say, because of acidity, there will be gastric upset, and because of that, there will be ulcers, there will be problem in the gastrointestinal mucosa, and that will lead to malabsorption. Along with that, if the animal is being fed a diet which is high in phosphates, so phosphate binders, that will also not allow the phosphorus to get absorbed from the intestinal epithelium. So this is one of the reason of hypophosphatemia, that the food is very high in phosphate binders, or there is some problem in the gastrointestinal tract, or because of the reduced pH of the gastrointestinal tract, there will be reduced absorption of the phosphorus, and that leads to malabsorption of the phosphorus from the intestinal tract. The second reason is because of increased urinary excretion. Urinary excretion, it depends on the presence of vitamin D. If there is vitamin D deficiency, the phosphorus, it will be excreted, it will not be absorbed from the renal tubules. Okay, so there will, because of hyperphosphatemia of parathyroidism also, there will be more amount of phosphorus, and that will be removed from the kidneys and from the urine. Actually, phosphorus is absorbed from the intestinal mucosa through a sodium phosphorus co-transport system. If there is any problem in the intestinal mucosa, this sodium phosphorus pump, it doesn't work properly, and this vitamin D, it is a loop actually, or it is a next stage of transporting the phosphorus and calcium to the bone, to the storehouse. So if this co-transport, sodium phosphorus co-transport, is not working properly, the phosphorus is not being absorbed, and when the phosphorus is not being absorbed, the vitamin D will not deposit the phosphorus in the bone. Again, if sodium phosphorus pump is working properly, but If the vitamin D deficiency is there, again this will not be transported and there will be hypophosphatemia. Again, gastric disorders, then renal disorders, they all decrease the absorption of phosphorus. So phosphorus is absorbed from the proximal convoluted tubule. So this is not being absorbed and this leads to phosphorus deficiency in the animal. Third reason is defective internal redistribution, because this is again syndrome which is called refeeding syndrome. If the animal is being starved for a long time and if it is offered a good amount of food, again there will be excess of certain minerals, there will be deficiency of certain minerals. Deficiency will be okay, but excess of certain minerals, that will not allow certain minerals to get absorbed. So this is called refeeding syndrome. Then hungry bone syndrome. Since the phosphorus is not in proper level in the blood, so there will be more amount of breakage of bones for maintaining the normal amount of phosphorus in the blood. But again, there is osteoclastic activity to bring down the phosphorus in the blood, but the bones, they are not being restored with the amount of loss. So this is called hungry bone syndrome, and this is because of hypocalcemia. And along with that, during the treatment of ketosis with insulin therapy, with the insulin therapy, the phosphorus is being also transported in the intracellular space. So the phosphorus level in the blood, it goes down, and the phosphorus, because insulin is taking glucose energy source, and it phosphorus is also a source for the ATP molecule. Another phosphorus is being consumed by the ADP for formation of ATP and for formation of energy, through which this our body or the cells will work. So because of ketosis, and when there is ketosis, there will be a reduced absorption of glucose. When you give insulin therapy, that will help in moving the blood from the blood to the intracellular space. So again, during treatment of ketosis and during insulin therapy, there will be again deficiency of phosphorus. And respiratory alkalosis, all these things, they again lead to phosphorus deficiency. So phosphorus deficiency is because of GI absorption, or because of increased excretion, or because of there is any defective internal redistribution system. Like from bones, phosphorus is being transferred to the circulation for maintaining the normal phosphorus level, but again because of hypocalcemia, again because of certain hormone deficiency, because of certain enzyme deficiency, the broken amount or the taken away amount is not being restored properly. So these are the main three reasons for hypophosphatemia. So pathophysiology of hypophosphatemia. As I said, this phosphorus is an important component of phospholipid membrane of the cell. Because of decreased level of phosphorus, what will happen? There will be membrane fragility, and there will be increased fragility of the RBCs. And these RBCs, since they become more fragile, they easily get destructed, and there will be intravascular hemolysis. Again, the phosphorus is a component of ATP molecule. So because there is a decreased amount of ATP molecules in the body, there will be decreased energy level in the body, and this results in fatigue, muscular weakness, and reduced muscular contractility of the cardiac muscles. So there will be fatigue of all the cells in and all the muscles in the body. So the animal will be dull, depressed, and lethargic. Then again, as I said, bone metabolism, phosphorus is an important component of bone. So because of decreased level of phosphorus, there will be hypophosphatemic rickets and osteomalacia. Many times when we see rickets, we jump to a conclusion that the animal is having reduced calcium level. So we go for administration of vitamin D3, we go for administration of calcium without even knowing that the amount of calcium in the body is normal. But many times it also happens that because of some gastric upset, gastrointestinal problem, the calcium and the phosphorus, it is not being absorbed, and because of that the bones, they become fragile, and they easily break, or the costochondrial junction, it gets enlarged, and it leads to hypophosphatemic rickets. And this is particularly seen in old age, that is osteomalacia, and the bones, they become very very weak, and there is pain in the bone. Another thing is that phosphorus, it is an important component of diphosphoglyceric acid, and this 2,3 diphosphoglyceric acid, it is an important enzyme. Actually, what it does, when the hemoglobin, it is then in the RBC, and when the oxygen in the blood, in the lungs, it is the this enzyme which actually combines the oxygen with the hemoglobin. So decreased production of this enzyme, what will it cause? It will cause reduced release of oxygen from the hemoglobin, because this hemoglobin is tightly bound to the oxygen with the help of this enzyme. If this enzyme is reduced, then the affinity of the hemoglobin to the oxygen is increased, and this will not allow the oxygen to dissociate from the hemoglobin. So what will happen? Even though the hemoglobin is full with oxygen, but because of the deficiency of this disease, it is not getting dissociated at the cellular level, at the tissue level. So the oxygen, though oxygen level and oxygen concentration in the blood is good enough, but there is tissue hypoxia. It is because of reduced amount of this enzyme. So the enzyme level has to be checked, so that when the oxygen molecule or the hemoglobin and oxygen molecule, they are reaching the tissue, where the amount or the partial pressure of the carbon dioxide is more at the tissue level, at the venous exchange. So this oxygen molecule should dissociate, and the hemoglobin should combine with the carbon dioxide. But in the absence, or in the deficiency of this enzyme, this hemoglobin molecule, it cannot release the oxygen molecule, and thereby the carbon dioxide concentration at the tissue level, it remains the same, but oxygen is not being released there, and this will cause hunger, oxygen hunger of the tissue, and lead to tissue hypoxia. Later on, there will be tissue necrosis.